Let's discuss about acute mastoiditis. To know actually what is acute mastoiditis and all, we have to first understand the basics and how the mastoiditis came into picture. Suppose this is the ear pinna and this is the external auditory canal and this is tympanic membrane and this is middle ear cavity and this is cochlea, that is called as the interna. The infection, if it has to happen, it can happen in the externa, it can happen in the media, it can happen in interna, right? If infection happens in media, it is called as a acute suppurative otitis media. Media means, what we mean is middle ear cleft. Middle ear cleft consists of 6 parts that I remember with this benzene kind of ring. So here is a eustachian tube and middle ear cavity, and then attic, then antrum and adytus, 3 A's, and then mastoid air cells. One more time, I remember this with a hexagon benzene kind of thing. So here will be eustachian tube and middle ear, and then 3 A's, adytus, antrum and attic, and then 1M, that is air cell. You can remember by A also, that will make very easy. That is A and A, 4 A's, that is air cell, antrum, adytus and attic. So altogether consist of middle ear cleft. So this middle ear cleft infection is called as acute suppurative otitis media. That's how we came into the picture of acute suppurative otitis media. Now suppose the infection has come and went, that is called as a ASOM. Suppose there is a long standing infection of this middle ear cleft with ear discharge and tympanic membrane permanent perforation. There is tympanic membrane permanent perforation, as well as there is ear discharge. This is our pinna and this is externa and this is tympanic membrane. Suppose there is a long standing infection and that is causing tympanic membrane permanent rupture and ear discharge with chronic infection, that is called as a CSOM. So first we have discussed about ASOM and then we came to the CSOM now. The complications of CSOM is intratemporal, that is restricted to the temporal bone only, or intracranial, that has went from the temporal bone to the intracranium, that is already spread. That picture is called as an intracranial complication. So complications are intratemporal and intracranial. In intratemporal, we have acute mastoiditis, the hero of this picture. So acute mastoiditis. Now come to the acute mastoiditis as a proper chapter. Acute means what? Acute means suddenly something has happened, sudden onset. And mastoiditis, don't be afraid of so many things that are there in this slide. I'll just keep on explaining, just follow me through this, okay? First, concentrate here, don't concentrate anywhere in the frame, okay? Concentrate here. Acute mastoiditis. Acute means something that has sudden in onset. Mastoiditis means there is an infection. This infection is spreading from the mucosa of mastoid air cells to involve the bony walls and of mastoid air cells. Suppose these are the mastoid air cells, okay? Mastoid air cells, okay? There is a mucosa lining here. The pus has been collected here. The pus is spreading from the mucosa of mastoid air cells and then erodes the bony wall and it is spreading. This is called as a mastoiditis. Okay, now we are clear with the mastoiditis. What kind of infection we are talking about? We are talking about beta hemolytic streptococcus, most commonly occurring in the children. There is any other organisms also that are causing mastoiditis, but most common is a beta hemolytic streptococcus. So infection, why actually infection is spreading? Because of the increased virulence of these bacteria, or there is decreased immunity of the host. In case of the measles, erythematous fever, poor nutrition, diabetes mellitus. Imagine this is a child, this is a child here, child, he is very sad because he has got these red spots all over his body, and also there is fever. Okay, there is why this is fever and measles have come, and because of this he is not eating properly also, and his mother is a diabetic case. So that is just a story to remember. Okay, this is just a story. Okay, diabetes mellitus, poor nutrition, exanthematous, fever, and then measles. Okay, now we have discussed about acute mastoiditis, right? Infection, we have discussed about this part, and then spread, and then we come to the bony walls. Because this bony walls have eroded, all the mastoids together will now become a big pus pocket, that is called as a empyema of mastoid. How this will occur? Because of the production of the pus under tension, and there is a hyperemia decalcification. Suppose this is our mastoid air cells, as we have discussed. There is an infection spreading, this is the pus, this is the infection spreading to the mucosa, then eroding the bony wall. So this production of the pus under tension and then hyperemic decalcification, a mastoid can happen. The pus breaks through the mastoid cortex and then it erodes subperiosteal abscess it forms. This is the whole pathogenesis of acute mastoiditis. Now we have discussed this only part, okay, bluing part. Now let's go to the red ink part. Wherever I have marked from the red ink, it is just clinical features and signs. First come here. What do you mean by CSOM? It is a long-standing infection along with the ear discharge and tympanic membrane perforation that I have shown here. Tympanic membrane perforation, and there is a ear discharge along with the chronic infection that is called as a CSOM. Do you remember? Okay. So yeah, this from this you can remember that ear discharge is a sign and tympanic membrane perforation is a sign. Okay. So two signs we are got over with the previous slide. Now come here. Since it is acute, there will be pain. So it is also one clinical feature. Pain is a symptom. Then since there is a pain, there can be a mastoid tenderness. If you put your thumb or a finger on the mastoid, then the patient feels tenderness. So that is a sign. Then mastoid swelling is there. Pinna is because of this mastoid swelling, there is a pinna pushed forwards and downwards. Now coming to the mastoiditis, this ear discharge is there, right? Because of all these ear discharge and all, tympanic membrane perforation and ear discharge. This ear discharge is pulsatile. It is coming in pulse first and then second, like this pulsatile it is coming. So that is called as a lighthouse effect. Because of this perforation, tympanic membrane permanent perforation, there will be conductive hearing loss. This is also a sign. So remember here that whatever I have kept with the red ink pen here, whatever I have written with the red ink pen, those are all the clinical features. And just symptoms are pain and pulsatile discharge, ear discharge and fever. These are the three, and toxic and ill. These are the symptoms. Rest all are signs. Okay. Now we have reached till here, conductive hearing loss. Since there is infection, there will be fever and the patient will be toxic and ill. Since there is a abscess and eroding abscess, sagging of the posterior superior meatal wall is there. To understand this, we have to go in depth a little bit. Suppose this is a ear, okay, this is auditory canal, this is tympanic membrane. This we are seeing as a cross section, okay. Here is a posterior and here is an anterior. Just imagine in a 3D. Stand in front and look at yourself in the mirror. Then put your hands parallel to the ear. Imagine posterior side and superior meatal wall is there, right? That meatal wall is sagging. It is when the doctor is looking from the otoscope in the externally auditory canal, here he is looking external auditory canal. The posterior superior wall of this external auditory canal is looking bulged and as if it is sagging downwards. Why it is happening? Because of this antrums are filled with the pus. it is pushing everywhere, right? Because of the antrum is shared with the wall of the antrum is shared with the external auditory canal. Because of this pus pushing, there is the sagging of, there is bulge in the external auditory canal. So this is called as sagging of posterior superior of meatal wall. This is also kind of a sign. So that's about the acute mastoiditis. Quickly we'll revise. Okay. ASOM, external media and interna. Media ASOM, acute infection. Then middle ear cleft we have discussed with the hexagon, as here external eustachian tube, and here middle ear. Then all the A's, everywhere A's, that is attic, antrum, aditus, and then mastoid air cells. Then long standing ear discharge is there, tympanic membrane perforation, long standing infection is there, then it is ASOM. Complications are intratemporal and intratemporal and intracranial. In intratemporal we have acute mastoiditis. Acute mastoiditis, that is just an infection spread from the mucosa of mastoid air cells and to involve the bony walls and bony walls of mastoid air cells. Infection increasing because of the increased virulence or decreased immunity. Most commonly affected are children. Most common organism is beta hemolytic streptococcus. Then this bony erosion, because of the bony erosion there is spreading of everything. Coalescence of all these mastoid air cells become one big mastoid air cell filled with the pus, that is called as a empyema mastoid. Pus breaks through this mastoid cortex, this big mastoid is there, no, pus breaks through this cortex and causes the subperiosteal abscess. And then since this big mastoid air cell is there, it is sharing the common wall with the external auditory canal. Because of this pus spread, there is a bulging of external auditory canal. When the ENT surgeon looks from otoscope, he sees posterior superior wall sagging and sagging in the external auditory canal. That is sagging of the posterior superior meatal wall. Since it is acute, pain will be there, mastoid tenderness, mastoid swelling, then pinna push forwards and downwards, pulsatile ear discharge, and this is called as a light hose effect. Because of this, conductive hearing loss is there, tympanic membrane permanent perforation that causes the conductive hearing loss. So infection is there, so fever and toxic and ill. The patient looks toxic and ill. So that is about acute mastoiditis.